when we are asking our societies to come in solidarity of our doctors and healthcare workers, and so the empathy which we expect from them also to these healthcare workers, what is the challenges and what are the hazards they are facing when they are ensuring that our continuity of healthcare is not broken, and we, all of us who require any kind of medical support, keep getting that. We have a very esteemed panelists with us now on this particular panel, and I would like to introduce them first. We have Dr. Sampath Kumar. He is the head of Nephrology department at Meenakshi Mission Hospital and Research Center, Madurai, and a tertiary referral center for the management of high-risk nephrology cases. We also have Dr. Narayan Prasad. He is a professor, Department of Nephrology at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, and he is also honorary secretary in Indian Society of Nephrology. He was also a member of Global Burden of Disease GBD 2016 study. We also have Dr. Rajinder K. Dhamija with us. He is the head of Neurology department at the Lady Hardinge Hospital in New Delhi, and a very well-known name in the public healthcare system and in his specialty of neurology. So we will also be joined soon by Dr. Nimis K. Desai. But before that, we'll begin our discussion today. And I would like to start with Dr. Professor Dhamija. Dr. Dhamija, you are working in a hospital in the heart of this country at the national capital, and you are seeing a lot of COVID burden also being managed by your hospital, I believe. When you see these, your own colleagues, your own paramedics, your own nurses, and your own team of doctors, and what are the challenges actually they face when they go out and make sure that the continuity of treatment is not broken, or we keep providing the healthcare for everyone who need it?
Good afternoon, everyone. And at the outset, I would like to express my thanks as well as gratitude to the IHW Council and Kamal Narayan for organizing this mammoth event in the honors of doctors and other healthcare workers, and giving us this opportunity to share our thoughts and experiences during this crisis time, which WHO has rightly termed as a humanitarian crisis. So I have actually lived in Australia for many years, and my family lives there, and I have worked there with my other doctor colleagues. And I would like to start this presentation by reading a tweet from one of my Australian friends who is a doctor, and this tweet he tweeted in the month of March. Mind you, we had about 500 cases in the month of March when we started the first lockdown, and Australia also had about 500 cases at that point of time. So he tweets that I am Dr. So-and-so. I am about to separate from my family within my home for uncertain number of months so that I can keep treating you while trying to keep my family safe. It hurts. No hugs from my daughters, no cuddles from my partner. Please, please, socially distance now to make my sacrifice worth it. So that was the kind of a expression from a doctor who was embarking upon a journey to COVID-19 pandemic. COVID-19 has brought entire world in a tough time. A lot of doctors who have been brought in front as a frontline warriors and are treating day in and day out for these patients, risking their own, not only their physical health, but also mental health at risk. just for the sake of humanity, for the treating patients, and on the face of fighting a invisible enemy on the line of duty. So in the next 10-15 minutes, I'll walk through this august audience three aspects of this scenario. One is how a medical professional is going through a journey through the COVID-19 and their families. The second is what society expects from us, from the good doctors, and what the doctors expect from the society. And lastly, I would also like to touch upon the other stakeholders, the healthcare system providers, the governmental organizations, the NGOs, how we can change this challenge into the opportunity of strengthening our public healthcare system. So let me begin with what makes a good doctor, what society expects from us during these times of crisis. So there are certain qualities which makes a good doctor in front of society during these times when we are going through the tough times of the pandemic. So the first one is compassion. So the compassion is basically an ability to identify the suffering of another patient during this time. So we have to imagine ourselves in a similar state in which the patients and the families are going on. So that is a compassion, and that is an integral part of a medical care system or a qualities of a good doctor. And it's a basic grounding principle on which whole holistic care is delivered. The second quality which I would like to emphasize is understanding. So what is understanding? The understanding is just not the knowledge. It's not merely the knowledge or the comprehension. This is ability to think and act within what we know. So understanding from the patient's perspective is equally important. So he is telling you something. So we need to understand what's going on in his mind, in his thought process, in his illness, in his physical illness, in his mental state. So that understanding imbibes in us in providing a good medical healthcare provision in these tough times. You're learning to improvise your understanding is something like playing in an orchestra or a piano. So it's a skill which comes with the time, and it's an integral part of the care provided being in this tough time. The third one and the most important aspect which I want to highlight is empathy, which you rightly pointed out in your opening statement as well as the subject of this session. So empathy is just not the warmth which we normally try to exhibit as a warmth. In more academic terms, it is actually a social emotional ability to having to understand two different things. One is you at the level of your affective, where you ability to share the emotions of others. The other part is cognitive effect, which is ability to understand the emotion of others. So these two things are very important. Empathy on the part of the doctors and empathy on the part of the society. So when we are dealing with this kind of epidemic or pandemic, they behave in a very set pattern. The pandemics are always known to come from international travel, affecting the rich class and their relatives and the families, going on to the urban slums, going on to the rural and semi-rural areas. So that is a set pattern which we are seeing it. And this pandemic of COVID-19 has also undergone this trajectory in last 6 months, from China to US to Europe to Indian metropolitan cities to the urban slums and to the rural and semi-rural areas which now we are going through. So empathy is one part of the expectations from the society, from the doctors. On the other hand, on the other side of the table for the doctors from the society. So that is very, very crucial part which we need to understand when we are facing through a crisis and fighting an invisible enemy on the line of duty. So we need to understand each other's perspective to deliver a good healthcare system. The next one is the honesty. We have to be honest to understand realistic approach, not a fearful approach. What we are going through is not a panic or a fear psychosis in the minds of doctors and their families, as well as in the minds of the patient itself. So we need to be very honest to ourselves and be honest to the society. And the another one is commitment. Commitment is a personal resource. This protects from the negative aspects of the stress, and which enables them to attach a direction and meaning to our work which we're providing. So commitment is our armamentarium, which protects us from the stress and strain of everyday pandemic scenario which we face day in and day out. So apart from commitment, another comes the humanity. if most of you will be knowing Dr. Sir William Osler, he said a good doctor treats a disease, but a best doctor treats a patient with the disease. A great doctor treats a patient with the disease. So we all have to imbibe this principle, and being a good person, being a good human being is the paramount importance. We have to be good human being in everyday sphere of life, not only the hospital. We have to be good father, a good husband, a good citizen, a good person as a customer in a departmental store, or a good spouse, or even a good citizen on the road while driving. So a good human being has to be a good doctor, and on the other hand, a good person on the street. And last one, a good quality which I always attribute to a good doctor is the courage. Courage for a doctor is a moral courage to stand up. If something is going wrong, you have to stand up. Whether it is disclosure of a medical negligence or something not going right for your colleague, for your hospital, for your patient. So you need to have that moral courage to stand up and speak. Whether it is the healthcare system, whether it is the community, whether it is the hospital, whether it is you personally, or related things. So all these things the society expects from us during the times of this pandemic. On the other hand, as a doctor, what I expect from the society, from the community, is community participation, which I call it as a Jan Bhagidari. So doctors are doing their job, the governments are doing their job, the administration, the other researchers, the clinicians, the lab people, they are doing their job. But as a citizen, what is my responsibility? I need to follow and adhere to all the advices given by the doctors, public health officials, the government. When I drive on the road, when I take my car on the road, I put on seat belts. I keep a distance from the others to protect myself and to protect others. The protection of my life is also in my hand. When I take a bike or somebody takes a bike on the road, you wear helmet. You keep on seeing on the left side, on the right side, keep distance. Similar thing happens now. So when you go out, you wear a mask. You keep a distance. You protect yourself and you protect others. So that is responsibility of the community, society, or citizenship, a responsible citizenship. That's what the doctors, as a doctor, as a clinician, as a neurologist, as a public health expert, I expect from the community to help me combat this pandemic, to change the virus, not the virus changing us. So that is very important from the society part of it. So what I need to tell you now, how to touch upon, I'll just touch upon the healthcare system, how to take this pandemic head on, and how to convert this challenge into an opportunity. So we need to come together, all the stakeholders, whether it is the public sector or the private sector, whether it is the NGOs. So we need to work collectively to deliver healthcare, to prevent the disease. We need to find out people who are harboring virus. We need to aggressively testing. We need to test enough to keep the positivity rate of less than 5%. So it is very simple. If you have 50 people in the community and you test 100 people, you will have 50% of positivity rate. But at the same time, if you test 1,000 people, you will have 5%. So we need to have more testing, more tracing, more tracking, and then treatment of those who are really sick. We don't want to bombard our hospitals with all the sick people at the same time. And that was the purpose of lockdown, that so many people should not come together at the same time, becoming sick with COVID-19. And that has given us time to build up infrastructure in terms of labs. More than 1,000 labs are now working. More than lakhs of beds are now in place. More the ventilators are in place. But still, we need one more focus point, which I want to highlight from your channel, from your platform, that we need to strengthen our public health system, primary health system, as well as district health system. You remember bringing a ventilator into a district in Punjab makes a headline in the newspaper. So that is the state of affairs of our district health hospitals, which are big hospitals actually. There was no ventilator in one of the districts in Punjab. And when the ventilator came, it was highlighted in a newspaper, a national newspaper, that the ventilator has come. So that is really, we need to improvise ourselves. We need to improvise our primary health system. A lot of groundwork has to be done to strengthen primary health system, as well as the district health system. World over, all over the people are talking about primary healthcare, but we have not focused even on our secondary healthcare. We have a dichotomy of having a big corporate hospital, state-of-the-art facilities in India, where best can be available anywhere in the world, but also we have a very poor district health system. We have not invested much into our district or secondary health system, which we need to focus now. And we should take this opportunity to transform our, not only the primary and tertiary healthcare system, we should also change the secondary health system, which is at the district level. We have more than 700 districts in our country. If we strengthen that system, we would be better prepared to face this pandemic. Now, lastly, I just want to touch through my personal journey through this pandemic. So my family lives in Australia. So my son, whenever he goes to office from 9 to 5, outside 9 to 5, he always concerned about his dad, whether how many patients I'm seeing, whether I'm having my sanitizers in my car or not, whether I'm putting a new mask or not, whether I'm keeping all these precautions. As a son, he's always worried about his dad. My partner is always concerned about my well-being, whether what time I'm in the hospital, whether I'm coming back in time, whether I'm taking all new precautions, all advised precautions or not. And in this high-risk emergency situations like COVID-19, where the doctor is subject to number of competing duties. So we have a lot of duties which compete with each other. So our duty to patients, our duty to protect ourselves for undue risk of harm, our duty to our own families, our duty to our own colleagues in the time of stress, strain, whether absence of one person who builds up another person's work and increases the harms in the one's absence, and our duty to society. All these duties compete with each other. But having said that, there is a great deal of pleasure. That is why we signed up for this profession. My mother, who lives with me, she's 80 plus, is always worried about me. But I always tell her, Mom, this is like being in the army. Once in a lifetime, you are in the action. So we have to do it. ये तो करना ही पड़ेगा. Lastly, the satisfying part of our professional duty is that we can, and we are in a position to make a difference. And we must embrace that. Thank you very much for giving me this question.
Thank you so much, Dr. Dhamija. Really a moving account, which included both your personal side and also the most interesting aspect of it, that what you highlighted about your friend who sent that tweet and said that all of us, the entire nation, the entire world need to make sure that what sacrifice our doctors are making, and this is a once in a lifetime opportunity. They are getting this, they are on the war footing. It does not come every time. But good part is that they are rising up to that occasion. And we as a nation and the humanity or the people need to make sure that we are, with them, and we are doing whatever it is needed to make sure that they are not getting any further risk, but at the same time their sacrifices are not going waste. So thank you so much for highlighting these aspects, and we really are grateful for you for your wonderful work you are doing, despite being away from your family, and ensuring that the care must keep reaching to the people. Now I'll go to Dr. Narayan Prasad and try to understand. He is in one of the the largest hospital of Uttar Pradesh, and one of the, I think, these are the mega institutions of our public healthcare infrastructure. Dr. Narayan Prasad,
yeah,
how is the life for you there in Lucknow's Sanjay Gandhi Hospital? And also, when we try to highlight that our doctors are working amid scarcity and there are resource crunch for sure. Dr. Dhamija very well identified that even a ventilator coming to Sangrur district of Punjab. Sangrur is the district, I believe, where has become a national news. So, and the same was the problem, I think, only also for PPE kits or maybe masks, or many of the hospitals have really seen that crunch. How was the life in Sanjay Gandhi Hospital, and what you believe, as a society we should be understanding about the medical profession now and forever?
Yeah. At the outset, I would just like to thank you, Mr. Kumar Narayan, and IHW Council for this opportunity to be with you on the social media. And this is one of the great platforms to expose yourself and to convey your message to the public also. The most important thing what we observed during this period, you have first talked about the Lucknow. You understand the Lucknow, particularly whole of the Uttar Pradesh, is a totally densely populated state. And it is the population of Uttar Pradesh is equivalent to a whole of the Australia that Dr. Rajinder Dhamija was talking about the Australia. So, and in that situation, when you have, there is big gap between the demand and whatever you can supply even to the general public, when in terms of the healthcare, we all understand infrastructure of health is not that great, particularly in Uttar Pradesh and in many parts of the India also. This is overall the situation of the whole India, except some part of the South India, where you can see up to the marks like the Kerala and Tamil Nadu. But in majority of the places, we have very large gap. The reason what I am talking about, everything comes from your economics. When you look at the health economics of India, what you are spending on health infrastructure, it is only approximately of 3% of your GDP. When you will compare it with these other different countries of the world, one of the developed countries like USA. USA is spending 17% of its GDP. Germany is spending about 11%, Iran 9%, Spain 9%. China is spending almost twice of the India on their health infrastructure. So it is likely to be not that optimum. As Dr. Dhamija was rightly pointing out, the most important deficiency is there. Our primary health center is not up to mark. That needs to be built up. Here, asymptomatic patients of the COVID, who needs to be, that patient can be taken care at the PSC level, that patient can be taken care at the DSC level. Asymptomatic patient, totally stable patient, no respiratory involvement. Why these patients should go to a tertiary care hospital to engage one bed where invasive ventilation and other important treatment can be given to them. So this is the biggest lacuna happening in the whole infrastructures. We need to improve our primary health center. We need to improve our secondary health care structures. And then comes this. Definitely there is our health structure. Overall 80 to 90% is totally dependent on the private sectors. Only 10 to 20% is provided by public sectors. Of when you consider all health structures of India. Then at this time of the COVID, when you look at, the majority of the burden comes from the public sector hospitals, and the public sector hospitals are overburdened. At the same time, the health policy is such that many of the non-COVID patients are suffering. They are not able to get their treatment. When you have this, suppose myocardial infarction happens in any patients, they want stenting, they want angioplasty, they need angioplasty many times. At non-COVID days, any such patient will get this stenting. But at present, what is happening? Most of them are enforced to go through your thrombolysis process. So you might also have listened. This is not, this COVID is affecting the care of the COVID suffering person. It is also affecting the non-COVID persons. Recently, we have done the survey of the 19 different hospitals of 2,500 patients caring centers, where what we have observed, many of the patients are dialysis patients. I'm talking about the dialysis patient. These patients land up in the emergency dialysis. Many patients missed the dialysis. 9 patients immediately died within few days. So this survey was indicating that almost at the end of the 3 weeks of the survey of the first lockdown, when our total number of COVID patients suffering was only 500 when the first lockdown was announced on 25th of the March. Within the 3 weeks, almost 113 patients, 104 was missing at the end of 3 weeks, and 9 patients had died. That was the confirmed death due to this lockdown effect. So what was this? Why this happened so? So this was totally, we all can understand, this was unpreparedness before the lockdown announcement. So there is a particular way to control this pandemic that we are not able to do, I can openly say, because it requires epidemiologists. This should be in the hand of the epidemiologist how to drive out about the lockdown. You need economists. You should have the balance between the two so that the progress should remain continued. That should not hamper. So all these things are, that has not taken in the way. But definitely this was the greatest step that anywhere the pandemic like this happens, the most important things comes always in the mind about the lockdown. So lockdown, as you also might be experiencing, and you might agree with me, this lockdown, what this has done, this could not prevent the spread of the disease. Usually what happens, this gives you the time to improve your infrastructure. In between, when you have the lockdown, pupils are not moving outside home, remaining at home, so you would have the time to improve your infrastructure. Once they would be out, there would be some peak of the disease, they can be taken care. And usually the ultimate aim happens for the herd immunity. So everyone has to wait for the herd immunity to develop. So this lockdown was not proper, what I feel. We need several things to be done from the basics. Improve our primary healthcare, secondary healthcare, and then it comes like this secondary healthcare. Definitely, Uttar Pradesh is totally burdened. Now the cases are coming. Our capacity at the Sanjay Gandhi Postgraduate Institute is about 200 patients for the COVID, 200 beds are there. Now, at present, we are full by 120. The last week, we had only less than 100 patients, but it is going on. Now, every day, 15-20 new patients are coming. Definitely one important factor which we observe here are the mortality. So many people claim that this mortality might be manipulated and might be underreporting of this mortality, and that many things came in the media also. But despite being this manipulation, we understand that the mortality and of this COVID in this part of India is definitely less. Then there might be many reasons, but what I expect the most important reason, when you look at as compared to your USA, our elderly population, when you expect that your elderly population of more than 60 years age is only 8%. In contrary, in USA, elderly population is there of 16%. If they take their definition of more than 65 years. So elderly population gap is there. Other important thing is temperature and humidity. Now there are several environmental studies came, and that has shown if with each degree change in the humidity and temperature, at least not the incidence, not the total COVID cases, but fatality go down. So this might be the other reasons. And then definitely you might have heard the multiple news and media that the BCG vaccination is also activating your basic innate immune system. And so that is also preventing. And in India soon, the first vaccine given at birth is the BCG vaccine to any child. So that also might be one of the factors for preventing and having the low fatality rate in India. As far as you have also pointed about the supply of the PPE and N95 mask, initially at SGPJ, we have a lot of problem in getting these old supplies. But now, for the last 1.5 months, probably that lockdown period has given us preparation for the times and getting all these materials supplied to the institute. Now, it is not looking like that problems. And our healthcare workers are also now acquainted for this. But definitely we are at stress. Half of the hospitals is still locked in the lockdown phase, that we are not able to start the routine care. But in half, beds are open for the emergency patients. Emergency patients are coming. We are admitting them, or we are caring for them. In the last week, we have done 2 renal transplantation also. And we are able to provide hemodialysis to all needy patients. And almost 100 of the hemodialysis are done every day at our institute. So that kind of care, we are trying to balance this COVID and non-COVID care at our institute. So I think nothing is more intelligent than human being's brain. I think a human being would be able to take care of this COVID also. And you also understand that there are so many antiviral drugs are going on, will likely to come. And it is likely that when the vaccinations would be successfully come out of this phase 3 trials, then definitely that will be the one of the major equipment for the doctors to take care of this COVID-19. And as this is a gratitude week, so I will not forget Dr. B.C. Rai. He was born in Bihar, Patna. So I am also from the Bihar. I am also from Patna. So this great man who died, whose birth date was 1st July, death day was the 1st July, great human being, great doctors, great philanthropists, whatever you can say, great politicians, on whose name this National Doctors Day is celebrated every year. And this is very official. So my all gratitude to him, that one of the doctors' name, this National Doctors Day is celebrated across India. And my full gratitude to him. And my gratitude, one other important thing which I want to highlight about every time the people speak about the doctors as a corona warrior. So in the May, there was one newspaper article that was showing almost 30 doctors have died during this COVID period. So during this COVID, if they are warriors, some of the persons fighting at the borders, they die, they are declared as martyrs. And definitely all these fellows might have saved several lives than before their death. So through your channel and through your media, social media, I would like to express my gratitude to all these doctors. I will request you and all the publics to support that all these doctors who are dying here, fighting this or saving the life of the people, should be also declared as martyrs who died at the borders. If any soldiers died at the borders, they are declared as martyrs. Why not about these doctors who are dying, saving so many lives? And then they die at the end because of unwanted disinfection. So this is my point, and I will like to get the support of all the doctors and social media on this point. And at least this will be the real tribute, real gratitude to all of my colleagues and my doctors. Thank you very much for this opportunity.
Thank you so much, Dr. Narayan Prasad. And one thing which you highlighted apart from that, the martyrdom of the doctors, is that somehow probably we lost the opportunity of lockdown and we did not prepare as well as we could have. As far as your point of, giving the real gratitude to our doctors is concerned, I'm happy to share with you that from yesterday we started a campaign among the entire, we are requesting the entire population of our country, our people, that to request the government of India that we should have, like every nation creates war memorials.
Yeah.
In respect to the warriors or the soldiers for their country or the wars they have won or even lost.
Yeah.
We also need to have a memorial of our health warriors. And these are not the warriors only of this pandemic. Doctors are always vulnerable for many infections at hospitals. And doctors are always fighting to save as many people as possible. With the demand that by having a national gratitude memorial for health workers, we will also highlight that health is something which everyone should respect as they respect the defense mechanism.
Yeah.
It may also help governments to look into health in a much broader manner, much more essential manner, like they look at defense. So as you mentioned that about the GDP percentage being spent in India vis-a-vis other countries, we also spend a good amount on defense. We must keep spending a good amount on defense. But we also should make sure that that defense is to save our people. And without healthy people or health of the people, that defense will be meaningless.
Meaningless, yeah.
What we will do by defending just a diseased population. So that is where we have started, and thankfully MOS Health, who attended our initiative yesterday, he has agreed that he will take it to the government, and he has said that he will also request to the Prime Minister, and he in a way said that probably Prime Minister is thinking something on this line. So let's wait, and we will be very, very keen to see that something comes which makes people remember about health every day. And
put my statement also there, so that because this is one thing which is hunting for. So if you are declaring as a warrior, doctor is such as other novel profession that everyone understands this. It is possible that many of them things like this might be the second god on the earth, and that you also understand this is no longer existing as a second god, because there are so many disputes going on in the society against the doctors, for the doctors also, but there are a lot of disputed things are coming with the commercialization of the healthcare system.
This initiative is aimed to that, to bring back that trust. There is a commercialization, there is a distrust, there is a lack of satisfaction among the patients. There is also lack of satisfaction among the doctors.
Yeah,
patients need more empathy from you. You also need more empathy from them. Yeah. It is both way. Yeah. It is not always that a doctor is always negligent. Yeah. It is also that patients are also negligent, but nobody says that it is a patient negligence that killed the patient.
Yeah,
it is always a doctor's negligence. It's always a medical negligence, never a patient negligence. So what we are saying that at both sides it has to be balanced. Let me go to Dr. Sampath first, and he has been waiting, and then we will come back to have a little bit more discussion on these points. So Dr. Sampath Kumar, Dr. Narayan said that almost every part of North Indian region is not having that kind of healthcare infrastructure, highlighted by Dr. Narayan as well as Dr. Dhamija. You are in the more I think privileged part of our country as far as the healthcare is concerned. While you have a more privileged infrastructure, and I'm sure that it will also be supporting you well from the infrastructure point of view. Again, come back to the point that this is the time when our healthcare workforce is working amid scarcity, and scarcity of all type. It is not just the scarcity of having enough N95 masks. It is also a scarcity of having that emotional support system around them. So what you feel as a doctor, what is your opinion that what as a doctor, if you are in the front line of COVID-19 war or not, because even if you are not in front line of COVID-19 war, you are almost working in the same affected environment, if not infected environment. What do you expect from the society, the government, and your colleagues.
See, thank you very much for this great opportunity to interact and give our views on the burning issues which are facing the society now. As far as the Tamil Nadu is concerned, initially it was sitting pretty, and then we realized that socio-demographic advantages are totally annihilated by the virus, which doesn't respect any society's improved society's infrastructure. If you can see the type of havoc it has caused amongst the highest economies. So Tamil Nadu is a sitting duck, I would say. And you can see that the number of cases are tremendously increasing, putting great the strain on the infrastructure is tremendous. Whatever be the advantages that Tamil Nadu has in contrast to other parts of the countries. The as the war continues over the last 6 months is that mental fatigue has set in. Mental fatigue amongst the healthcare workers is now going to be the physical stamina can go on, but once mental fatigue sets in, the other things will rapidly come down. So the enthusiasm to work and enthusiasm to see that the patients get better is slowly dwindling. And this is, I feel, is the greatest challenge, because the pandemic is not going to leave us, and it is going to be with us for another 6 months to 1 year. And we need to have strong messages coming from the government as well as the public figures, that this is the very, very crucial time when during the initial phases, when there are not many cases, both physically and mentally, people are prepared. Now, as the cases are peaking, both the mental challenges are coming up. This, I feel, has to be taken, and the platforms like this, once we are putting it into the Facebooks and in the community, I'm sure this will really give a positive messages.
Thank you so much.
Yeah.
So let me then go to Dr. Dhamija, and Dr. Dhamija wanted to share something. Dr. Dhamija, you mentioned about very well, you elaborated about that, the empathy and how we should look forward that from both the patient and doctors also need to have the same, the emotions. Dr. Narayan also has highlighted that the point of declaring our doctors as martyr. You wanted to say something on that. So first, your comment on that.
Yeah, I fully endorse your views and Dr. Narayan's view. In my view, if it is possible, we can also think of having a small memorials in the hospital. I used to work in Melbourne Hospital, where in the hospital there was a memorial for the war memorial, Vietnam War Memorial. So, like in Delhi, so far 6 doctors have died. This is data from the Delhi Medical Council. As of today, six doctors have died because of COVID-19 in Delhi. So why can't we have this small memorial in one of those hospitals where we have lost these corona warriors? So bigger on a macro level, the things are at the government level. On a smaller level or a micro level, at the hospital level, we can have a plaque, we can have something which can remind us the sacrifices made by our colleagues during this difficult time. So that's what I wanted to make a comment, that there are many ways we can commemorate, we can celebrate, we can remember these warriors and their contribution to the society during this pandemic time.
Thank you so much, Dr. Dhamija. It's a wonderful idea, actually, that to have some kind of those symbols and those memorial for these doctors who have led their life while trying to save others. and they could have chosen to be at home, but the demand of duty definitely make them go out and make sure that they are providing the care. But what my vision is that the health has to come out of hospitals. If we want to have a memorial of health and healthcare workers, it need not to be always within the hospital. It has to be at a place where everyone can see and then remember that, okay, health is something which they need to be careful about. They need to remember about. They need to be taking care of it. So hospital idea is definitely a very welcome idea, and I'm sure you will also try convey this message. We are also running this the campaign, and historically countries have built war memorials, police memorials and monuments for leaders, legends, for their sacrifices, landmark contributions. And as a health and well-being institution, we at Integrated Health and Well-being Council request to the people of India and the fraternity and the medical community also to come together for this movement of noble cause and showcase solidarity for the purpose. So, Dr. Sampath, what your closing remark now on what is going to be important when it comes to a patient's mindset towards doctor, and I believe it is made on the experiences of every patient. When Dr. Narayan says that people died because of dialysis, I'm sure the patient who lost that life or the family member, for them it must be a failure of their doctor also, and it can be for many others as well. So or somebody who is going for a cancer treatment. I just got to heard about a case happened in UP only, where a cancer patient was kind of asked from 5 hospitals to go to the other hospital in 5 different cities of Uttar Pradesh. So they were almost traveling the whole week with the patient from one hospital to other to get the treatment or even the diagnostics, but nothing happened. So what is your opinion, Dr. Sampath? How should the whole system and the doctors community should deal with that, and how the patients should also take into this into their consideration?
No, the only appeal that I would like to give for the public is that doctors cannot be equated as saviors for 100% of the patients that they are seeing. You will have to understand that the law of averages work in every disease, and also it also works with every doctor. In contrast to, if you see the comparison of the perception among the public about a sports person, for example, you take Sachin Tendulkar. But if he is treated as one of the greatest batsmen in the era of in the modern era, but you can just see how many times he has failed to score below 50. But those things are never taken into consideration in the public mind. But in contrast, a doctor is supposed to succeed in every patient that he treats to the amount that 100% of the patients that he treats has to become better. This is the public's mindset. That mindset has to change. If that changes, and if the public also believes that doctor works to the best of his abilities, if the disease per se is so serious and is severe enough, no doctor on earth can cure certain multi-organ failure patients. So that perception, realism should sink in amongst the public. Number 2, as far as the role of a doctor is concerned in this scenario, I would like to say that there is a lot of fear amongst the doctors to treat COVID positive patients, fearing their own life and their health. To make things better, we need to have quick delivery of the diagnostic methods percolating into every state and every district level, so that once the patient is perceived to be a non-COVID patient, then the doctor's level of management and aggressiveness immediately improves. So that the diagnostic testing, be it RT-PCR or antibody testing, should be quickly coming into the every nook and corner of the country. The third aspect is that we have been concentrating too much on building low-cost ventilators. Now we realize, as we come 6 months into this pandemic, that ventilators are not the way to go. We need to have more personal protective equipments like N95 masks and also the foods and other things which are going to be most important as far as the healthcare worker containment of the disease is concerned. So that is also another area that I would like to comment on. Thank you.
Thank you so much. Thank you so much, Doctor. Dr. Dhamija, you wanted to say something.
Yeah.
Please, so we'll be closing in 2 minutes. Please.
Yeah, I just want to convey my messages through your channel. There are three things. One for society, one for doctors, and one for the public health officials or the government. So I start with the public, that you need to adhere to the advisories given by the officials. Time and again we have been giving. At the same time, do not be socially isolated. Just maintain a social cohesiveness. Be in touch with your family, be in touch with your colleagues, be in touch through whether it is electronic media, smartphones or whatever. So be socially cohesive, not socially isolated. The point number two, which is for the public health or the governmental organization, is that we have been talking about the GDP expenditure, which is 0.9% in India and 16% in Australia. So we have been setting targets over the 10 years time that we will increase to 3% by this year, 2014, 4.5% to 2020, 2020, but we have not been able to do so. So I call upon the health economists as well as the governmental, whether it is state or the federal government, to please look into this and strengthen our secondary as well as primary health care. And third thing, for our doctor colleagues, medical professionals, we have an opportunity in our lifetime to handle this pandemic. We are fortunate enough to serve this society and humanity. Most of us are standing and rising to the occasion, and I must compliment and feel that they should be acknowledged and complimented for that. Thank you.
Thank you so much, Dr. Dhamija, Dr. Sampath Kumar, and Dr. Narayan Prasad. We are really grateful to all three of you. You all are doing your best, and Dr. Dhamija is actually also fighting this coronavirus pandemic on the front line. And I'm sure all of you are trying to bring the best care to your patients, and that no life is suffering. Thank you so much, everyone. Thank you so much, doctors.
Thank you. Thank you.